But let's talk about the NHS for now, though, because Roy Lilly's here, former NHS Trust Chairman, Health Policy Analyst. We spoke the other day, Roy, very good morning to you, about what was going on with the junior doctors. They, I think, are accepting that 22% pay rise, even though they're saying they might still go on strike again next year. Wes Streeting is now telling the GPs, whatever you do, please don't go on strike. But the BMA seems to think that they should.
Yes. OK, let's try and unpack some of this. GPs are not employed by the NHS. They have contract with the NHS. Their businesses, you know, their practices are called partnerships, and they contract with the NHS to provide primary care services. They're paid by the number of people they look after and for additional services, looking after the elderly, vaccinations and all that kind of stuff. It's a complicated way of paying them. At the end of the year, the difference between what it's cost them to run their business, their staff and their overheads and so on, and what they've been paid in contracts is what they call their surplus, and they draw down against the surplus during the year for their salaries, and that's how they do their thing. That's how they make their money. So it's quite complicated. It's not, we don't pay the GPs a salary as such. So they've been running into trouble because, like all of us, you know, the heating and lighting bills have gone up.
Yeah.
GP surgeries are often very specific. If they've got treatment rooms or pharmacies, they've got air conditioning running, they've got wages that have gone up, they've been hit with huge costs. And, of course, they've been hit with huge demand. GPs are doing an unparalleled 1 million appointments a day. they've never been so busy. So the last government, to try and help that out, came up with a thing called additional roles, where GPs were paid extra money to employ people like pharmacists and physiotherapists and so on to lighten the load on GPs. Now, that money was very helpful. A lot of people were employed, but what the money could not be used for was to pay for more GPs. And so we had a situation in some cases where GPs couldn't get a job. New GPs couldn't get a job. Right. Now, overnight, Streeting has come up with a response to all this, and they're saying that they will now allow the what's called the additional roles reimbursement, that's for the physiotherapists and the pharmacists, that can be used now to recruit more doctors. Right. Now, that, of course, will go quite a long way to solving the GP's problems. Plus, they've offered an increase of about 6% on the general GP contract. So hopefully that might sort of see them through the woods without a strike, because GPs do over 90% of first contacts in the NHS. We all go to the GP first, and they only get 11% of the budget for it, but 90% of us go to the GP first. If they're going to limit the number of us that can go to just 25 consultations a day, where most GPs are doing now 40 consultations a day, that's a nightmare. It's a nightmare for patients with sinister symptoms who may be very seriously ill and needs to be spotted. Yeah. The other problem is, you know, everybody running a hospital this morning is thinking, please don't let the GPs go on a work to rule, because we know what's going to happen. Everybody's going to pitch up in A&E with them.
Well, exactly. But presumably this extra money that's going to be given, it says here the changes could mean an extra 1,000 GPs deployed over the next 12 months. I mean, are there another 1,000 GPs that they can find? Where are they going to find them from?
Yes, there are. I mean, there's been an increase.
And what are they doing at the moment then?
GPs. Well, there was a story in the press the other day. One of them was working at Asda. So,
yeah, but I mean that can't be serious, can it? Really, seriously?
Well, you know, if the GPs can't get a job as a GP, I mean, I suppose they could do locum work and they could...
Yeah, I mean, come on, I don't buy that. I don't believe it. I mean, to be honest, because if you know as well as I do, some of the best money you can make is as a locum, where you can get paid like £1,000 an hour or something ridiculous, or £1,000 a day. You can also go and attach yourself to some private clinic. You know, there's plenty of work if you're a qualified doctor. If you're working in Asda, I would suggest there's something wrong with you.
It was a good story. It's in the press, Mike. It must be true.
Yeah, well, of course. I mean, it's probably one of those pushed out by BMA going, oh, look, we found this guy, go and get a job in Asda. You know, it'd be a good story for us. You know, it's
you're right.
Nurses going to food banks, isn't it?
And I tell you, another very attractive way the GPs are earning money now is a lot of them are working for online companies where people have a subscription to an online doctor on their phone.
Yes.
get an immediate appointment. I mean, I saw an advert the other day for a GP. It was, I think it was about, it was about 5 sessions a week. It was 70 grand a year.
Yeah.
You work from home, they supply you all the kit. You can link into the NHS database so you can see patients' records, and you can work from home.
Right.
And a lot of GPs are doing that.
Yes, and there's also what I noticed, certainly in London, and I imagine in other cities around the country as well, a lot of these kind of instant walk-in centres being started up where you can go and see a GP, obviously privately, and you pay a fee for that. But an awful lot of people are doing it because it's so hard to see their own GP. They're willing to pay, you know, sometimes 40 or 50 quid for the privilege of just sitting in front and getting some FaceTime with a doctor.
Yes, you're right. And, you know, I mean, if I go back to when Virginia Bottomley was the health secretary,
Yes.
she had the dentists. The upshot of the row with the dentists is a lot of them went off and worked for a company called Denplan. And that's what started the private insurance for dentistry. And now, of course, it's very difficult to get an NHS appointment with a dentist because they're mostly private. And there are now a number of companies that are starting the same thing, like Denplan for doctors. You know, we call it Doc Plan.
Yeah.
Where through a subscription, you can either see your doc on the phone or although you can see them privately. My worry is that if we don't fix this, there will be a migration out of the NHS into these doc plan type insurance schemes, which will be very popular, you know, amongst the sort of Waitrose generation in the sort of wealthier parts of the country. And that's I think is a big worry.
Yeah. Well, you'll also get more and more companies in the end offering sort of, you know, private medical insurance plans, and it will start to become a bit like America, where people get jobs in order to get medical coverage.
Yes, you're right. A lot of companies offer that now. And, you know, I go back to the time. Do you remember when GP surgery suddenly started popping up on mainline railway stations?
Yes.
Waterloo, you could go in and see a doctor.
Yeah.
That was very popular for commuters. It stopped because British Rail put the rents up and you couldn't make money at it.
Right.
Listen, the big future for primary care for most of us, not all of us, for older people and people with long-term conditions, they want a family practice. But the big future for most of us is on the phone and doing what we're doing now on FaceTime.
Yeah.
I mean, that's really where all this will end up, I think.
Yeah, I think you're probably right. Roy, good to talk to you. Thanks very much indeed. Roy Lilly, former NHS Trust Chairman and Health Policy Analyst.